Thank you all for taking time to join us today for our 2025 point-in-time sheltered and unsheltered count training for all of our surveyors and providers. Really appreciate you taking your time out of your day today to join us, and we have a lot of good content to get into. So if you could take a moment, and a lot of you have already started doing that, so thank you. Please introduce yourself in the chat, share your name, organization, and what balance of state region you will be conducting the point-in-time survey in. Again, this webinar is being recorded and will be made available on our website, so anybody who misses today will be able to catch up on the content and be able to participate in this year's point-in-time count. So again, we have a lot of agenda items today. We're going to start with some quick intros, go over the point-in-time count, why we are doing this, what is done with information, why it's important. We're going to talk about the distinction between our sheltered and unsheltered count, go into our regional approach of how we tackle this as a large balance of state CoC. We will also take some time to go over the survey itself. So we will be reviewing all of the questions that are asked and the instructions for the survey, whether that's electronic or paper. Now, if you could pop to the next slide, that'd be great. And then we will also take some time to talk about our youth supplemental survey as well as incentives. We also know that trauma-informed care is an important practice in the point-in-time count, so we'll be talking some specifics about what that can look like. And then we will be wrapping up with some information about how to keep ourselves safe during the point-in-time count, as well as the folks that we will be talking with, as well as privacy and confidentiality, as we will be working with people's private and personal information. So I want to start quickly with some introductions. My name is Jerry Erickson. I am the Balance of State Continuum of Care Program Manager. So I work for the Colorado Division of Housing, and I am one of our primary contacts for the Balance of State as well as the point-in-time count. I'm going to pass it to Natalie, who can introduce herself as well.
Hi, y'all. Thanks for being here. My name is Natalie Georgalis. I use she, her pronouns, and I am the Balance of State Continuum of Care Specialist here at the Division of Housing. Thanks, y'all.
Thank you. And then we have three other members of our team, Ashley, Matt, and Carla, who are not on the call today, but are an important part of the point-in-time. Ashley is our primary contact for our Office of Homeless Youth Services, and therefore will be our point of contact for the Youth Supplemental Survey, which we'll talk more about. And then Matt and Carla are on our Homeless Management Information team, and they are the primary HMIS contacts, as well as the contacts for our housing inventory count. So that is our whole point-in-time team at the Division of Housing. And then we also have our regional point-in-time coordinators. We're going to talk a little bit more about what that means, but each region has a point-in-time coordinator or a point-in-time lead, and those folks are listed in a list we have on our website, and Natalie's going to pop that in the chat for us as well, so you can know who your regional PID coordinators are. So 2025, our point-in-time is for the Balance of State is scheduled for Tuesday, January 28th, 2025. This year's point-in-time count is a sheltered and an unsheltered count, which I will define further, but make sure that you have that date marked. So what is the point-in-time count? What are we talking about? And for those of you who participated year over year, we appreciate it, and apologies for any reviewing of information that you're already familiar with. But the point-in-time count, or PIT count, as we will say, is a count of all people in our continuum of care who are experiencing homelessness on a single night. And we are collecting demographic and characteristic information about them to better understand the state of homelessness in our communities. This effort is a HUD requirement. So the U.S. Department of Housing and Urban Development requires COCs to conduct the point-in-time count. And it must be done within the last 10 days of January of each year. In the Balance of State, we have a tradition of doing it on a Tuesday, so the 28th was selected for this year. In the Balance of State, we conduct a sheltered count every year. So each year we are counting all of the people in our communities who are in shelters. And then every odd year, so 2025 included, we are also conducting an unsheltered count. So trying to identify and count every person who is experiencing unsheltered homelessness within our CoC. So for the sheltered count, that is emergency shelters, transitional housing, and safe havens. And then for unsheltered, it's anybody who's staying in a place not meant for human habitation, which again, we will dive into a little bit further. So we conduct this count partially because it is federally mandated, and it's the only federally mandated count of people who are experiencing homelessness. And because of that, it really does heavily inform Congress about how many people are experiencing homelessness on a given night. And they use that information to determine funding and to better understand the state of homelessness in our country more broadly. So while we know that the point in time count is flawed in certain ways, in that we are only counting a single night. All of you in Colorado know that that night, who knows what the weather is going to be like or where people will be. So it can be very difficult, but it is important information for our congressional leaders. So we try to put our best foot forward and count as many folks as we can. It also really can help our continuums of care, our balance of state continuum of care, as well as our local communities. It can help us track and understand needs around homelessness, measure progress in our efforts in ending homelessness, and can help inform policy. It is also a really wonderful way to engage our neighbors and community members in efforts around understanding and ultimately ending homelessness. So we often utilize volunteers, many of whom are on this call. So again, thank you for your time to participating in this effort. But it is a good opportunity to educate our neighbors and bring more people into the fold as we work to really understand and ultimately end homelessness. It can also help a community identify our strengths and gaps in things like our outreach efforts, our homeless response system more broadly, and our housing stock and availability, and really arm us with information to better advocate for those who are experiencing homelessness. Ultimately, point-in-time efforts also enable us to apply for HUD funding, which can increase available resources in our communities and hopefully, again, continue to support our efforts to end homelessness. So, like I mentioned, this year, our point-in-time count starts on Tuesday, January 28th. It is important to note that it starts in the evening. And you'll see here in the middle that we can continue to collect those surveys and count folks through the following Monday, February 3rd. But please do note that we are always going to be asking people where they slept the night of Tuesday, January 28th. Because remember, this point in time count is intended to be counting all people experiencing homelessness on that one single night. So even if we are collecting those surveys later, we're always asking about that Tuesday. And because we are trying to count and identify folks who are staying in a place not meant for habitation, we are starting to collect surveys in the evening. So we will not be collecting any surveys during the day or prior to the 28th. We are waiting until we are as close as we can to being where somebody's actually going to be sleeping that night, because we know that people's situations can change. So if we're talking to someone in the day and they think that they're going to be staying in a certain area of town outside, maybe they're able to stay with a friend or are able to get connected to a shelter resource. So we want to minimize errors by starting in the evening of the 28th. I also want to note that each region in the balance of state has a different outreach strategy. Some are focusing more on the night of the 28th, and others have additional outreach efforts or events throughout the week. And the last date to complete surveys with folks is that Monday, February 3rd. And then regions also have an additional week to get that information submitted to the Division of Housing. All of the surveys, paper or electronic, which again, we'll go into each of those options, need to be submitted to the Division of Housing by the 10th. And we'll go into more detail about what that looks like. I also want to note specifically for our sheltered count providers, providers should aim to collect the data for the PIC count on the night of the 28th. If you do have concerns about completing surveys that night or throughout the following week, please reach out to your PIC coordinator and feel free to include Natalie and I for some additional support and problem solving in that. Okay. So let's go into a little more depth on our definitions of homelessness. So sheltered count, our sheltered point time count, like we've mentioned, happens every year. And is the primary and often only focus on even years. So 2024 was a sheltered only count. And our sheltered count is working to identify and count everybody who's experiencing homelessness in an emergency shelter, in a hotel or motel that is paid for by a nonprofit or government partner, transitional housing, or safe havens. So these programs are tracked by the CoC, so Division of Housing staff through our HMAS team and with Natalie and I. And each year we reach out to those providers to support their collection of the surveys. So that is done primarily on the provider level. Our unsheltered point in time count is where a lot of you will be coming in this year, although I'm sure some of you are shelter providers as well. So again, we are conducting an unsheltered and sheltered count this year. And to do that, we need to make an attempt, do our best to survey all individuals in our region who are experiencing literal and unsheltered homelessness. So I'm just going to read this definition from HUD about what unsheltered homelessness is. It is defined as an individual or a family with a primary nighttime residence that is a public or private place that is not designed for or ordinarily used as a regular sleeping accommodation for human beings, including a car, park, abandoned building, bus or train station, airport, or campground. So HUD would generally consider people, individuals or families that are sleeping in a garage, a shed, or another location outside of a housing structure, but maybe that's on a property of someone's house, as unsheltered homelessness. So that's an important distinction. Even if they are at somebody's residence, if they are in a place that is not intended to be a housing structure, then they can be considered unsheltered. HUD would not consider anybody sleeping inside of a housing structure as unsheltered. So if they are doubled up, if they are sleeping on someone's couch or even in their kitchen or bathroom, because they are inside a housing structure, they are not considered unsheltered homelessness. However, somebody who is sleeping in the hallway of an apartment or building or outside of an apartment or building would be unsheltered. I do want to go through some other common scenarios we see. Like I mentioned, anybody who is considered doubled up or couch surfing, staying with various family members, friends, acquaintances would not be considered unsheltered homelessness. And I think an important consideration in determining if a situation is unsheltered homelessness when somebody is in a structure or building of some sort is if they have access to water, heat, or utilities. If they do, if they have access to a bathroom, cooking facilities, water and heat, then they are not considered unsheltered homelessness. However, if they are in a building or an RV, for an example, that is not connected to utilities, does not have those services, then it would be considered a place not meant for human habitation, and therefore they would be considered unsheltered homeless. So if you are struggling with a situation that you're dealing with on the night of the point in time count, and you aren't sure if they should be considered sheltered or unsheltered, think back to this. And then if you're still uncertain, I would complete the survey with them and make a note somewhere in that survey that you have a question about it, and somebody can talk to you after. Okay. So for anybody who may not be familiar with our Colorado Balance of State, we are a continuum of care that covers all 54 counties outside of the Front Range. And we do take a regional approach to this work, knowing that Colorado is very diverse and varied with different resources and needs. So we have 10 regions within the Balance of State. And each of those regions has a designated or multiple designated regional PIT coordinators. We are very grateful for our coordinators who help take this vision of what the point in time count is intended to be and really execute that on a local level so that we can do our best to count as many people experiencing homelessness as we can. Natalie just linked that in our chat, and it is also available on our website so you know who your local coordinators are. The other major party in our point in time count is you all, or the people who are doing surveys. So our surveyors conduct the point in time survey and provide that information to our regional leads, who then ultimately provide it to the Balance of State CoC, which lead agency, again, is the Division of Housing. So we are responsible for creating a big picture point in time plan, partnering with those regional coordinators to develop training materials, collect, clean, and submit our data to HUD, and ensure that all of our HUD regulations and requirements are met for the point in time count. So how do we actually do the point in time count? HUD really encourages us to use our homeless management information system as much as we can to generate our PIT data, both for sheltered and unsheltered. And the reason for that is it really does take a lot less effort to do that, and it also reduces the multiple times that folks get asked similar questions. So we are doing what we can to leverage our HMIS system as much as we can and make it as simple as possible. But we know that not every organization uses HMIS, so we also have other survey options. So we have 3 options. First, like I mentioned, the HMIS data pool using our homeless management information system. The second option is a manual electronic survey. That's for both sheltered and unsheltered count. And then the third option is a paper survey for our sheltered and unsheltered count. I do want to note, though, that paper is our least preferred option because locally we will have to, people in our regions will have to take those paper surveys and input them into our electronic system. So we're essentially doing double data entry at that point. So we really are trying to lean on our electronic survey as much as possible. We know that that is not always an option, though, so a paper survey will be made available to everybody. In the event that you are not able to, or you have some sort of technical malfunction with the electronic survey. So I'm going to talk a little bit more about the HMIS data pool. Excuse me. Our HMIS leads, so Matt and Carla, generate our providers' point-in-time data automatically, and that means that our providers do not need to complete those electronic or paper surveys. Again, this is preferred and recommended because it is efficient, it is easier to reduce duplication, and it's faster for providers and PIT coordinators. It's also more cost effective because the data information is already there. We do not need to take the time to do those manual surveys. And again, that trauma-informed component. We're not asking questions of folks that they've already been asked, sometimes multiple times, and really asked to bring up events of their life that may be traumatizing. So know that our Balance of State staff have already reached out to agencies that use HMIS about this option and are working on testing some data pulls. And if you are an interested agency but have not talked to anybody about that yet, please submit a help desk ticket. And our HMIS team can connect with you and see what that could look like for your organization. Yeah, I see a question from Carrie.
Hey, I was just wondering, do you happen to have any time frame for when we're going to get the those HMIS data pulls?
I believe they're starting testing next week. I'm not certain about that. Natalie, do you happen to know?
I don't, but we can ask our HMIS team and then include that in the follow-up email for you, Carrie.
That would be super. Thank you. I just get a little anxious-y.
Sure. Definitely understand that. Appreciate it. Okay. The second option is to do our electronic sheltered and unsheltered survey. This is our preferred option if HMIS is not available. And we are using the platform Survey 123. Again, we will not be accepting any paper surveys. So if you or anybody in your community is doing paper surveys, your PIT coordinators will need to be working with volunteers to input that data into Survey 123. We do like that tool because it can be used in an offline mode. So once the app is downloaded on a phone or tablet and set up to access the survey, the point-in-time survey, survey responses can be submitted even if you are not connected to the internet. And then once you connect back online, the surveys will be uploaded to the platform. So it is user-friendly if you are out in the field working with folks. The link will be emailed to our regional PIT coordinators and posted on our website shortly, and we will have a more focused Survey 123 training. Natalie's also going to walk us through what that looks like so you can all see exactly what you will be seeing on the 28th and in those following days. Please do, though, have some paper surveys on hand as a backup in case there is some sort of unexpected technical difficulty, and make sure that those get entered into Survey 123. So always carry some paper surveys as a backup. The electronic survey, we have this bit.ly link that you can use or QR code. If you want to scan that, I will stay on this slide for a moment. This will take you directly to our Survey 123 survey, and there's an option to conduct the survey on the browser or get the app. If you are going to be out in community, please get the app. If you are trying to do it in the browser, if you do not have access to the internet, that upload option for offline mode will not function. So make sure you have the app if you're going to utilize that functionality. Okay, and then the last option is our manual paper survey. Again, Natalie's going to share what this looks like, but we will not be accepting the paper surveys directly. Those will need to be input locally. Again, these will be emailed out and posted on our website. And there are some minor changes from last year. We've adjusted our age brackets to better align with HUD. There were some text updates for clarity and deduplication of the questions, and then just some spacing and formatting. So nothing substantial in terms of the content we are collecting, more of just accessibility and being able to read the survey a little bit more clearly. Okay, the last type of count I'm going to discuss is our observation-only counts. So these are, an observational count is used to produce an estimate or a head count without any actual interaction or surveying of folks who are unsheltered. This is not our preferred method of counting, but sometimes it is the only option. So if, for example, you are doing a point in time survey out in a community and you come across somebody who is sleeping, we do not want to wake anybody up and disrupt their sleep for the point in time survey, but we do want to count how many people are experiencing homelessness as well as we can. So we can use the observation only count on that night of the point in time count. Again, this is not preferred, but it is an option. So to document those observational counts, we are going to be utilizing our unsheltered survey, and as much as we can, putting in a description of where they were sleeping, and an estimate as best as you can of how many people you see sleeping, and any physical characteristics to describe them, like their clothing. We are not expecting you, and you should not be collecting demographic traits. We don't need to guess at their gender or race unless you happen to know who they are and they just happen to be sleeping. But we, again, prefer not to use observational counts, and when we do, we are identifying the number of people, where they are staying, and any descriptors that we may have. And there is an option in our electronic survey to capture that observational count. So we'll see that in the survey 123. Okay, I'm going to pass it over to Natalie to review the survey itself.
Thanks, Jerry. Before I jump into this, are there any other questions? I didn't see anything come through the chat. Yeah, Julia.
Thanks. I'm just curious, for pulling data from HMIS, will all folks who are enrolled in our outreach program, regardless of when the last time we saw them, get pulled? Or are we, as we're going out and we see somebody who's already in our program, is that getting sent in?
My understanding is that it is not everybody who's enrolled, who's ever been engaged, regardless of when you last saw them, that they will need to have an updated current living situation on the night of the 28th, and those folks will be pulled. Again, our HMIS team will reach out with some more information, and we can reach out to them and try to include some more in our follow-up email as well. But it's that current living situation update that is coming from you all who are in outreach programs that will trigger that person to be a part of the report for the point in time count.
Okay, that helps. And we wouldn't necessarily have to actually talk to the person if we can identify them.
The preference is that we are somehow connecting with folks, confirming where they're staying, but they could also fit in that like observational bucket where like you know who they are, you know where they're staying, you happen to see them that night, then you could update their current living situation that way as
Okay,
well.
thank you.
Yeah. Any other questions before we get into the questions asked? Okay, take it away, Natalie.
Yeah, thanks, y'all. And just a note, I put this in the chat because I know this is a ton of information, and so y'all might have questions later. We will send out the slides, the recording, and any resources shared in the chat in a follow-up email. So don't feel like you have to like furiously jot down things from the slides or anything like that. Cool. Okay. So this is a screenshot of the paper copy of the survey. I'm actually going to... Let's see. Yes, you can see that. Okay, cool. It's kind of hard to read, so I want to pull it up a little bit better here for you all. So, there we go. Okay, so this is the paper copy of the survey. Both the unsheltered and sheltered count is done in one survey. I am going to go through the electronic version of the survey because that is the only form, again, that the balance of state and DOH is accepting. We are not accepting any paper copies this year, but I did want to show you all what it looked like. The questions in the electronic survey are the exact same. Obviously, they just look a little bit different since it's paper copy versus form. So just wanted you all to see what this looks like. Again, we'll include this in the follow-up email. It'll also be updated and posted on our website, as will all of our resources. So I'm going to go through and screen share now our electronic survey, and let me zoom in before I forget. Okay, cool. And just a couple of notes. Jerry already mentioned this, but just a reminder to download the Survey 123 app ahead of time. So for using that app, you do not have to have internet access or service to do these surveys. But if you're doing them through the browser, like I am right now, you will need to have internet access. So download the app ahead of time, and you'll be able to use that without service or anything like that. So this is the homepage of our survey. Again, sheltered and unsheltered are under one survey this year. And the front page here is just some general information for us. So this survey is meant for providers in the balance of state only who have not opted into using that HMIS pool. So we don't want to duplicate data there. If you did, we do have mechanisms to make sure it gets deduplicated. So don't stress too much about that. But this survey should not be completed with folks whose information is pooled already from HMIS. And then we're using this one survey for both unsheltered and sheltered, like I mentioned. And this is just a note to not enter any test or fake data, like I'm going to right now, on the night of the 28th or afterwards, because it just gets way too messy to pull out. So initial questions here are your information as the volunteer or the surveyor. So agency/site should tell us where the count is taking place. We do have most organizations listed in here, but if you scroll all the way down to the bottom, there's a lot in here, you will see an other option. So you'll be able to type in a agency or site if they are not listed. The next question is program, if applicable. So if there is a specific program that maybe is different than the agency or the site that you are completing the counts for, you can list that here. It's not required if it isn't applicable for you. That's totally fine. You will notice the questions with a little red asterisk next to them, and I can probably even zoom in a little bit more, are required. So that's another great thing about the electronic survey is it's going to require you to answer the questions that are required, which is helpful to avoid some of the back and forth of getting questions answered that might have been left blank. So program, if applicable, city and county associated with the location that the individual you are surveying is in. I'm just going to type in test, and then you'll select the county. And then this is your information as the volunteer or the surveyor. So your first initial, your last name, and then your email. And this is so we can reach out to you if we have any questions about the survey or the responses that you inputted. Next, and this is a critical question, asking the individual that you are about to survey if you can ask some questions for the point in time. So making sure that you are getting their consent before you continue is critical. So when you click yes, it will take you to the bulk of the survey. If you click no, it is going to take you to the observational count that Jerry was just mentioning. So I'm going to go through both pieces of this survey. And again, this is also the same in the paper survey. It's just less automatic than the electronic one. So we're going to say that this test survey said, yes, they are giving their consent for us to ask questions for the point in time count. So first question, where did you or will you spend the night of Tuesday, January 28th? There is a note in here that says if they are staying with family, friends, or a hotel or motel that they paid for themselves, stop the survey because they are not considered literally homeless under HUD's definition. So if that's the case, stop the survey, thank them for their time. Otherwise, you will select where they will be sleeping or did they sleep on the night of the 28th. And then there's a few questions related to length of time homeless. So is this their first time being homeless? How long have they currently been homeless? You'll select that answer. Including this time, how many separate times have they been homeless in the last 3 years or since January 2022? And if folks don't want to answer these or they're not sure, that is 100% okay. Just select unknown or not willing to answer. And then in total, how long did you experience homelessness in the last 3 years? So consecutively or altogether since 2022, how long have they been experiencing homelessness? One thing that I want to note on this is if you select that they have been homeless for a year or longer, the questions shift a little bit. And so if they've been experiencing homelessness for a year or longer, it asks, when is the approximate date that their homelessness started? So if they know the month and the year, enter that. If it's just the year, that's okay as well. And this information helps us as the CoC and also HUD understand the chronic homelessness within the balance of state, as well as the general length of time of people experiencing homelessness across the balance of state. So once you answer those, you'll go next. And this gets into the bulk of the survey and collecting demographic information for those you are surveying. So the first individual that you want to collect information for is the head of household. So if it's just a single person, this will be their information. If it is a family experiencing homelessness, you'll want to start with the head of household, and then you'll repeat these questions for every household member who is also experiencing homelessness. So the first 3 questions here are their first name, last name, and date of birth. For first and last name, we only need the first 3 letters. And that is because we want to be sure that we have unique information for folks, and we're not like combining individuals or duplicating surveys and not realizing it. But we also want to ensure that folks' information is kept private and confidential, and we're not getting information that we don't really need. So first 3 letters of the first and last name, it will let you type in more. Obviously, I typed in test, which is 4. So if you want to type in their whole name, but we only need first 3 letters. And then you will select or type in their date of birth. I'm just going to type in my own. And then it asks, is your date of birth after January 28th, 2000? Because then they are considered youth under our youth definition. So for this example, I'm going to say, excuse me, no, we're going to go into the youth survey a little bit later. And then it's going to ask for gender of the head of household. And this is a select all that apply. So you should allow folks to self-identify. And if none of these options feel right for them, there is a different identity box that you can then type in what they share with you. And again, this is a select all. So select all that folks identify with and share with you. Same for race and ethnicity. This is a select all section. So you'll select all that apply. You'll notice these are not required questions because, again, if folks do not want to share this information with you or just don't want to answer it, that's 100% okay. And then you'll ask if they are a U.S. military veteran, yes or no. And then you're going to go into disabling questions, disabling conditions and barriers. So when asking these questions, something that you want to keep in mind is that HUD is essentially looking for, is this condition expected to continue? And is it substantially impeding the individual's ability to live independently? And could it be improved by more suitable housing? So that's kind of the direct language from HUD there that they want us to keep in mind when asking these questions of individuals. So do they have a physical disability, developmental disability, chronic health condition, mental health concern, alcohol or drug use? Are they currently fleeing domestic violence? Have they been diagnosed with HIV or AIDS? And have they experienced a traumatic brain injury? So you'll select yes or no, and you don't need additional information for those questions. And then it'll ask if there is a second family member. So if there is, you'll click yes, and you'll answer the same exact questions with the addition of how are they related to the head of household. So if it's a spouse or a partner, child, or other, you'll select that. And then you will go through and answer all of the same questions for that second individual. And it will continue to give you the option of a third, fourth, fifth, sixth family member if there is a large family experiencing homelessness. Okay, any questions on that piece of the survey? I'm going to go back and show you all the observational count, but questions, things I could cover again or make clearer?
There was a question in the chat from Heather. It was a great question about if it would be okay to show people the documents and allow them to select their options themselves. I don't think I've ever been asked that question, so good thinking. I believe that would be okay. I do think we want to make sure that the people that we're surveying understand each question. So being able to provide clarification and support around understanding questions will be important. I am going to follow up with HUD and confirm my understanding. So that will be a part of our follow-up materials as well. At this point, though, I don't see a problem with that.
Cool. Anything else, y'all? Okay. I'm going to go through the survey again for the observational count, which is much quicker.
Sorry, Natalie, I'm going to interrupt again. We got another question about what counts as a family member? Families are self-identified, just like every other part of this survey. So if there's a group of people together that identify as a family, we are open to that. We are not prescriptive about what a family member is or is not. And now he's going to talk a little bit more about that. And Jack, I'll answer your question in the chat.
Cool. Thanks, y'all. Sorry, I can't see the chat while I'm screen sharing as well. So thank you for bringing those up. And yeah, good question. I'll just point out here that there is an option for other under relationship. So you can click other and type that in if it's not one of these kind of given options here. Cool. Okay. So for observational count, you start the test the same, or excuse me, you start the survey the same in entering your information as well as the site that you are surveying individuals, and if there's any program related with the count. And then when asking folks for consent in completing the survey, if they say no, you'll click that and it will automatically take you to the observation section. I will show you quickly what this looks like on the paper survey, just because it is critical to respect client choice and not complete a survey if someone doesn't want you to. So same exact concept in the paper survey. May I ask you some questions for the point in time survey? If yes, you'll proceed. If no, you will just skip this entire section and go down to the observational count at the bottom. So just wanted to show you all what that looks like in this kind of version as well. Excuse me. And so for the observational section, you will not be asking individuals any questions. This will just be completed by your own observations. And so where is the living situation associated with the observation? If you are outside, unsheltered in community, or in a specific hotel or emergency shelter. Are there other people, or does this person have family members with them? So is it just a single individual, or are there other people with them that appear to be in their household? So we'll say yes. It's going to ask you for the total number. I'm going to just say 2. And then observed age group of the individuals. And so these are your best observation. They are in groups to try and help with that because we know it can be difficult. So using your best observation for the first individual and their age range. And then if there are more individuals, selecting yes. And then it's just going to ask you for their age range as well. And you'll continue to do that for the total number of family members that you observe together. So that's it for the observed portion of the survey. Like Jerry mentioned earlier, you're not collecting any demographic information. It's just simply trying to collect any individuals who may be experiencing homelessness from our observations. So that is the electronic survey, as well as a quick snippet of the paper survey. And then again, I did just want to remind, we've said this a couple times and we'll probably say it again, only electronic surveys can be submitted to DOH. So if you complete a paper survey, someone within your region will need to enter that information into this electronic version that I just went over. Any questions about the observational count or other things that came up for y'all on the surveys?
There was a question in the chat about duplication, how we prevent that. So I just put back in the chat that that is prevented by asking people the first 3 letters of their first and last name, as well as their date of birth. The Division of Housing, we have a data cleaning process on the back end to remove any duplicates. So that is our best effort for deduplication. Okay, I don't see any more questions. So now we're going to move on and talk about our youth supplemental survey, which is an important component of our point in time efforts. So our youth supplemental survey is the same night as our point in time, so the January 28th, 2025. And this is a large collaboration among our Office of Homeless Youth Services at the Division of Housing, the Advisory Council on Homeless Youth, or ACHY, our Rural Collaborative for Homeless Youth, young people themselves, Continuum of Care, and various partners throughout the state. So this is not specific to the Balance of State. It is a statewide effort to try to count every young person who is experiencing homelessness or who is housing unstable. So where the point in time is federally mandated and required and reported to HUD by every CoC, the Youth Supplemental Survey is not, but is strongly encouraged across the state because it is used for our state efforts in addressing youth homelessness. So why is this important? So the Youth Supplemental Survey, I'll pull it up in here in a minute, but you will see that it gains or asks some additional information about people's life experience. And this is specifically for folks who are under 25. So we consider anybody under the age of 25, even the day before their 25th birthday, to be a youth in terms of the Youth Supplemental Survey. This survey does center youth voice in its development, data collection, and engagement. So there's been feedback from various young people throughout the state on this survey. We do use the data to help raise awareness about the need throughout Colorado's communities around youth homelessness, and guides recommendations to advance efforts to end youth homelessness for youth throughout Colorado. And it really does align with our Youth Homelessness Demonstration Program, or YHDP, which is a program that is getting started here in the Balance of State. So it is a critical component. And there are some pretty significant differences between the Youth Supplemental Survey and the point-in-time count. Again, this is not reported to HUD or Congress, but it is incorporated into state and other reports. It is counting people through the age of 24. So for this year, it is anybody who was born on or after January 28th, 2000, which, if you remember when Natalie was going through the questions, that was one of the questions. If you answer yes, the Youth Supplemental Survey will come up, and I'll go through that in a moment. Another important thing is that the Youth Supplemental Survey uses a broader definition of homelessness. So it's not only counting people who are in shelter or unsheltered, but also who are housing unstable. So those definitions that we were talking about when we were going through examples of people in housing situations that are not considered literal homelessness per HUD's definition, those would be considered housing unstable for the purposes of the Youth Supplemental Survey only. So if somebody's couch surfing, doubled up, the Youth Supplemental Survey can be administered with them. You'll also see that the YSS collects additional information about various life experiences, and again, assesses both sheltered and unsheltered homelessness situations. I do want to note that the YSS is intended only for youth-headed households. So if there is a family with adults, but they also have somebody who's under 24, that would not be considered a youth-led household. It is only for youth or young people who do not have other adults in their household who are over the age of 25. Okay, I am going to share my screen in a moment to show you the electronic survey. It is automatically a part of the point-in-time survey, and that's what I'm going to show today. We also have a standalone electronic survey, so we will make sure that that is on our website and sent out to our regional coordinators as well. And then there's also a standalone paper survey, but similar to our point-in-time count, DOH will not be accepting those paper surveys. They will all need to be put in the electronic format before being submitted. So let me share my screen real quick. Okay, so I have already put in some information here to get us where we need to go. Is it coming up? There we go. Okay, so put in some test information for head of household, similar questions, first three, well, it's the same questions, first three letters of the first and last name, date of birth. I put a date of birth that is after 2000, so I put 2005, so I put yes. Then it is, again, very similar information to our point in time. We are asking gender identity, race and ethnicity, military veteran status, disabling conditions and barriers. And then you can also add a second, third, fourth family member. So for this example, I put a child in, again, first three letters of first and last name, date of birth, gender, race, military status, disabling conditions, and barriers. That is the only information that you will need for the additional household members. However, when you hit next, the youth supplemental survey comes up only for the young person that is considered the head of household. So again, we have a unique identifier, the first 3 letters of the first name and last name, as well as the date of birth, and they give you an example here. So you can see what that looks like. It asks what city and county do you live in or spend most of your time in? And then what city or county was your last stable housing? You can click same, different state from Colorado. If you select another city or county in Colorado, it will ask you to specify. So please complete that. It then asks what age they first experienced homelessness. Have they ever experienced homelessness while living with their parents or other legal guardian? And then again, gender identity. Similar to the regular PIT count. Oh, you should be able to select multiple, sorry. But there is another option. So if you select other, you can please input what they have self-described as their gender identity. Similar with sexual orientation, self-identified, whatever people identify as, and then other if there is not a selection in the survey itself. It then asks where they stayed the night of Tuesday, January 28th, and you'll see there's a lot more options than there are for the regular point in time count. It has a handful of unsheltered options like park, in a car, camp. There's a sheltered option, in a housing program, in a house with friends, in a house with families, in a host home, or a hotel paid for by them or their friends, or a hotel paid for by an agency. And then if it's a different location, again, there's that option to select that and type that in. This next one is a select all that apply. What things do you feel you have access to regularly? Food, water, warmth, social relationships, and safety is what we are looking for in this. So select any or none that apply. There's also a question about foster care, and that is, it does try to give some examples of what that could look like. So have you been in foster care in a home placement, placed with another family as a result of child welfare, residential child care facility, or a group home? Yes, no, or unsure. If somebody refuses to answer, just select the unsure button. And then if you select no or unsure, then that's the end. But if you select yes, it will come up with asking what the best option that describes how they left the care, whether they were reunited with their family, adopted, aged out, ran away from the placement, they're not sure, or some other reason, which again, you put in there. And these 2 questions are important because data shows that young people who are in our foster care system or other child welfare engagement tend to have higher rates of homelessness. So having more data on this lets us better advocate for our young people. It then goes on to ask if you have ever been involved in the juvenile or criminal justice system for allegedly committing a crime, and then asks if that's the juvenile justice or adult criminal justice system, neither or unsure. It then asks if they are responsible for any children under the age of 18. Again, if it's no, unsure, or pregnant, then that's the end of that question. If it's yes, it asks what the relation is. If it's their own child, sibling, or another family member, or significant other's child, or some other relationship. Yes, no, or unsure if they are currently enrolled in, registered, or attending school. What is the last grade that they completed? So it lists different grade selections there. It asks then if they're currently earning money, yes, no, or unsure. And then if the answer is yes, select all that apply, whether that's assistance, public assistance, work or job, panhandling, sex trade, drug trade, or other. So really trying to get at all types of income that somebody could have. The next question is if they had a serious problem, do they know a trusted adult or mentor that they could go to for help? If it's no or unsure, that's the end. But again, if it's yes, then it asks you to select most likely to go to for help, whether that's family, friend, caseworker, coach, school staff, or coach. And this is most likely, so it's a 1 selection. And there is another option there as well. Then it goes into in the past year. So ask them to think back to January last year. What has been a barrier or difficulty in assessing housing or housing services? And there are a whole host of different options here. So you can just ask that as an open-ended question and see what their answer is, find the closest selection here, or put in other. And then you submit it. And that is the end of the youth supplemental survey. Are there any questions on that? I saw some in the chat, but I haven't read them, or any that have gone unanswered.
I think I've gotten most of them. One more just came in. I was typing up and I'll answer quickly. Tara asked if doing observational counts and people are sleeping in a tight group or vehicle, are they considered family automatically, or should we put them in separately? And then Zoe actually answered it in the chat. If they identify as family, yes, but observation, you would put 1, 2, 3. It can be tough if we're not, if it's observational and you're not asking folks. And so it's really up to the observer. If you think they are a household family together or as individuals, the important piece is that each of them are being entered. And so data-wise, they're going to show up either way.
Okay, that's all we have for the youth supplemental survey. We still have quite a bit of information to go through. So we are going to go over, apologies for anybody who can't stay, but this is being recorded, so you can always catch the end on recording. Apologies for our timing here.
And I think the next few slides we can go over fairly quickly, so hopefully it won't be too long. But this first slide here, so we've mentioned incentives, I think, a couple of times, but when we are asking folks for their time and information, we want to value that by providing compensation through incentive. Every region will have different incentives, but all 10 regions were able to request incentives from the balance of state. So connect with your regional coordinator to see what's available in your region, and there should be some incentives available. Every person being surveyed should ideally receive an incentive, even if someone denies the survey and maybe they request the incentive, provide it to them regardless. Okay, this is a quick snippet of trauma-informed care that we are going to cover briefly. This, we could do a whole entire training on trauma-informed care, so I encourage you to continue talking about this with your organization and other volunteers, but priority is the, wait, we switched those words there. Safety is the priority of all parties. You as the volunteer and the surveyor, also the individuals that you are surveying. Client choice is critical here. So we've mentioned this a couple of times, but we do not want to pressure anyone to do anything, answer questions that they're not comfortable with. We want to respect their autonomy and their choice. And again, if someone denies the survey, accept that. That is totally fine. Provide them with the incentive. If they have specific questions, answer them. If not, move on. And that's totally okay. Do not speak up on anyone, identifying yourself and why you're there. This is something that ideally you are talking with folks about a week plus in advance. So letting folks know the week prior to the 28th that you are going to be coming out on the 28th or the day after to do this survey. So that way folks are aware of it and it's not a surprise. Being mindful of entering someone's space. We are entering these folks' homes. You are going into someone's home. So be mindful of that, be respectful, cultivate a demeanor that is laid back, open-minded, and puts people at ease. We don't want to make anyone uncomfortable, and we want to be as kind, as sensitive, hopefully as we always are during this time as well. Asking questions calmly without judgment, letting them know that this information is not only confidential, but there's no judgment on answers, what folks share with you in response to any of the questions asked. And then again, providing an incentive, or if you have any resources for your region that might be helpful, sharing that with folks as well. So again, this is a very, very, very brief touch on trauma-informed care. So please continue talking about this with your organizations and those who you might be volunteering with. A couple tips for safety precautions and privacy. Really two main pieces here. Discuss a safety plan with your lead, organization, volunteer group, whoever it is that you're going to be doing this with ahead of time. So that if a situation occurs where someone feels unsafe, you know what plan and precautions are in place and what to do in case that happens. So talk with your organization ahead of time and develop that plan and ensure the space offers privacy for the participant. So you're collecting sensitive information, or you might be collecting sensitive information that individuals don't want shared with others. So as much as you can, ensure that you have a private or some privacy when asking the questions from the survey. Okay. Safeguarding, storing, and disposing of completed surveys. Paper surveys, when done, should be kept in a secure location with limited access. They should be hand-delivered to the designated coordinator. If emailed, these should be encrypted and adequately tracked. So who had the survey, who sent it, and who was it sent to, so that you know who has access to the information. These should be kept on file until it is confirmed that they were entered electronically, and then they should be shredded. Electronic surveys are much easier. They should not be saved or stored to your device, nor should they be printed offline. When using the Survey 123 app, it's pretty difficult to do either of these two things. So unless it shouldn't be easy to do accidentally is what I mean. So just don't store them on the device and don't print them offline. Okay, and then confidentiality, just really hitting on this again. It is critical that we respect and prioritize confidentiality and safeguarding individuals' information. Everything that is shared with you while collecting surveys should be kept confidential, because individuals who are filling out these surveys are not signing a release of information or an ROI by doing so. So this means that any conversation that happens, anything that is shared with you during that time should not be released or shared with anyone outside of that conversation. Okay, I went through those fairly quickly since we're over time. Any questions, thoughts, concerns? If folks think of them afterwards too, we have our emails up here and we'll be sure to send these out.
And we'll be sending out the slides so you don't have to write down our emails. They will be sent to you as well. Okay, I'm not seeing any additional. Thank you all for staying a few minutes over to get in this last vital information. Again, your point time coordinators are a great resource for you, and we are also here to support you. So please reach out. And yeah, Zoe, it looks like you might have a question.
I was just going to say, on behalf of being a previous unhoused person and now currently working as a peer support specialist, I think you guys are doing amazing. It's amazing what you guys are doing, and I'm glad I could be a part of it with you.
I really appreciate that. Thank you. And thank you for volunteering, especially bringing your loop expertise. And thank you all for joining and taking time to do surveys with folks on the 28th and in the following days so that we can really put our best foot forward and hopefully represent all the people who are experiencing homelessness throughout our CFC. Thank you all. Have a great one. Appreciate it. Stop recording.